Welcome to the Health Matters program. I'm Alicia Martin.
And I am Nazim Hussain. Glad that you can be with us. We are coming on today's program from the Otter Chang Convention Center. It's been a busy day at the Caribbean Wellness Week activity here with the Ministry of Health and so many of its partners. Quite busy.
Definitely. And we have so much highlights to share with you today. We don't want you to miss it. So stay tuned.
We've got Dr. Monique Williams, Women's Health Coordinator of the Women's Health Unit of the Ministry of Health. And we will be talking about something which is not often talked about, and that's menopause. Welcome, Doc.
Thank you.
Tell us a bit, what is menopause, especially for young people who are watching?
Yeah, so menopause, Mr. Hussain, is basically the end of a woman's menstrual cycle and also the end of her fertility. Now, what usually happens is that the ovaries, they stop making estrogen and progesterone, which are two hormones that are needed to be fertile or to have fertility. So it is said that once a woman would have stopped seeing her periods for at least 12 consecutive months or more, she's in menopause. And this usually happens between 51 to 55 years old. But there are cases where it can happen as early as 40 years old or as late as 60 years old. It usually depends on your menarche, how soon you would have had your menstruation or how late you would have had your menstruation.
And so bottom line, this is a natural process.
Yes, it's a completely natural phenomenon for women.
Right, so you're looking at a year after the menstrual cycle. What else will be a telltale sign that this progression is in place?
Yeah, so there are some signs and symptoms that we as women experience when we go into menopause, and I think it's one of the reasons why this phenomenon is so difficult or a little bit taboo for us to go through. Now, one of the things that would usually let us know when we're going into menopause is that we start having an irregular period. All right. There are cases where persons suffer from irregular periods, but if you would have a regular period throughout your life and you start having irregular periods now, it's an indication that you're probably going into menopause. There's also hot flashes. I know a lot of women complain of having hot flashes. And then there's their mood swings.
There's hot flashes.
Hot flashes, it's basically you're just there and automatically you're just hot. This uncontrollable heat that's in your body, right? That you have no explanation for, especially if you're in a pretty cool place. There's also the mood swings. We tend to lash out because of these different mood swings that we're experiencing. There's also something that women struggle with when they're going through menopause, and that's vaginal dryness and soreness, which as a result makes sex a little bit painful. Not a little bit painful, it makes it painful. All right, they also have things like headaches. You suffer headaches. You have thinning of your hair loss. And because of the decrease in the estrogen hormone, there's a lot of loss in bone density, which now opens you up to something that's called osteoporosis, where your bones get fragile and you're more prone to fractures and these kinds of things. There's also palpitations. There's a lot of stuff that we as women go through when we transition into menopause.
So women might think that this is not necessarily a doctor's event. But once you have these collection of symptoms, if we may call it that, you think it's important for a woman to see a doctor?
Yes, we will always advise that you go reach out to your medical provider.
When it comes to that bones and so yeah.
Yes, and it's important to mention too that these symptoms could last for years. And as a result of that, it affects your quality of life. And because it affects your quality of life is when you should seek medical attention, because there is something that is called hormone replacement therapy or hormonal therapy, where we actually replace those hormones that are decreasing as a result of a natural process, so that you can ease some of the symptoms. You can ease or slow down the bone density loss. You can slow down the mood swings. You can also, slow down the vaginal dryness and stuff like that. So there there are things out there that we can use to help persons, go through menopause and transition nicely.
And oftentimes we might see a grumpy wife, we may not know what is happening, especially in that
Yes.
age. And so the family might think my mother is in a terrible mood today.
Yes.
As the case may be.
Yes.
It's important that we should have family support in these
Yes,
times.
it's definitely important, because if I am to really reflect, when I was much younger, I noticed that my mom was a little bit grumpy as we got older, and I couldn't relate to what it was. So that's where education and awareness comes into. That's why our ministry or unit now is pushing sensitization and awareness of menopause, because it really matters. We would ask the men to be a little bit more sensitive. As we were talking just now, if your wife gives you a call and say, I don't really feel like cooking today, could you pick us up something to eat? You don't complain, you fight, just pick us up something to eat, give her that ease. So give them support in whatever area they may need, and so that they can help with that transitional process, especially when it comes to the mood swing. If you have a change in mood, rather than lashing out with her, you say something that's calming or soothing. Oh, it's okay. How can I help? How can I assist? What is it you'd like me to do? Stuff like that. It really goes a long way.
What is easily available to assist with the hot flashes?
Well, the hot flashes, I don't think there's anything that's readily available. It's just that has to pass. That is something that has to pass. It's not something that lingers. It comes on quickly. It spends a few minutes or so, and then it passes.
And of course, as we say, it's always important to see a doctor and get a general medical checkup to see if any damages were done, as the case would be, and see how you can rectify it.
Yes.
And women, at the end of it, and as we wrap up, women can live an easy life and a good life with menopause once taken into consideration.
You can. Like I said, you continue to have the support of your spouse and your family members. You seek medical attention if it is the symptoms that you have really severely affects your quality of life. There's help where that is concerned. And I just want to stick in here too. It's very important to know there's something that's also called premature menopause, where a woman before the age of 40 goes into menopause, whether it be a natural process, a natural phenomenon, because there are persons who actually go into menopause very early, and those that go into menopause as a result of a medical procedure. Maybe they had ovarian cancer, they had to have those ovaries moved, they had a complete hysterectomy, and you go right into menopause. Those persons as well, you need to remember them, support them. There's also counseling that is available for you to transition very nicely into menopause.
And the Women's Health Unit, people can reach out to that unit?
They can reach out to us. Our numbers are 223-5310, and we can have talks with you. We can also channel you in the right direction to have professional, specialized help from the Georgetown Public Hospital as well.
We've been speaking to Dr. Monique Williams, coordinator of the Women's Health Unit of the Ministry of Health.
It was very effective because it's different, because you get to see different people coming out and showing care, understanding for different health cares and different illnesses around in our country. It was very educational. As a nursing student, it was very nice to come out to see a health fair where everybody could communicate, play games, and take part in activities that sometimes you don't really get to do. As a nurse, you're always worrying about everybody's health and taking care of patients. Sometimes you don't even get the chance to look at yourself. So I think that would be a change for me, to focus more on my health in every aspect.
So this is my first time attending a session like this. And to be honest, it's more than what I have expected. And it's good. You go about to various departments and ask questions, and they're willing to offer whatever they have to. For one, the men's health unit, I've been able to visit that service there, and there they offered a lot of things which I myself didn't know, and yeah, it's great. All right, so what I would do to improve my health is basically having, according to what the minister has said during his speech, is 8 hours of sleep, the maximum. exercise during the day, and most importantly, our diet.
Welcome back. I'm Alicia Martin. With me, I have Dr. Melissa Dehart, and she's the coordinator of the Elderly Health Unit. Welcome, Dr. Dehart.
Thank you for having me.
So, could you first tell our viewers about some of what is happening today at the Wellness Fair?
All right, so today, specifically for the elderly, we have the Elderly Health Booth, and there we'll be focusing mainly on information on all the affectations that there are for the elderly, specifically arthritis, dementia, nutritional aspects, dental, mouth care, physical exercise, all the things needed for a specific age. Because many persons will think that this is an overall thing, but for the elderly, we have specific advice that we can give to them. We also have representation of long-term care facilities, or we know them as elderly homes. But they are here to provide information of what is available for our families and loved ones if necessary as well.
Now, I know this month of September is known to be Alzheimer's month. Could you tell us a little bit about that, what it is and how is it connected to dementia?
Right, so the month of September is Alzheimer's Awareness Month, Dementia and Alzheimer's Awareness Month. This is something that's celebrated internationally, and this year's theme or focus is knowledge. Knowing Alzheimer's, knowing dementia, which is part of what we're trying to do here as well. Dementia is one of the more frequent affectations in older persons and one of the lesser known. So for this month, we're encouraging persons to access information. So some of the basic things or the more simpler affectations you would see with dementia are such things as memory loss, agitation, wandering, which is very important or one of the more important symptoms. This is where you would find people get lost, they leave their homes, etc., and they can't find their way back. You will also have changes in language. Persons may not be able to associate words to objects. All of this is with the memory. And we need to understand some things are normal, such as when we get old, we will have difficulties in memory. Sometimes you go into a room, you can't remember what you go in there for, and you turn around and then you remember. That's normal. As we age, forgetfulness is normal as well. But when it comes to Alzheimer's, which is one of the more frequent types of dementia, you will have things such as aggression, right? The person's acting out of character. You could also look out for, like I said, word association, not knowing objects, memory loss, not being able to recognize your loved ones or forgetting their name. Also, you would have, you will have things such as persons not remembering where they would place objects, right? Some other things we could look out for with Alzheimer's or dementia, are persons not being able to alimент themselves properly or eat properly, refusing food, liquids, solids, not being able to remember or take their medications properly. So all those things we can look out for when it comes to Alzheimer's and dementia. And keep reading. The Ministry of Health always has information. Make sure we know what's going on with our loved ones so we could seek help.
Definitely. Are these conditions very much prevalent in Guyana, and have you been seeing a lot of senior persons accessing the services that you guys have available with regards?
Yes, definitely. In general, not just in Guyana, the world over. Once persons would have entered that old age, 55 going on to 65 and older, they will encounter these problems. And presently, we do have services available to help with symptoms of Alzheimer's or dementia. It is important to know that Alzheimer's cannot be treated, but the symptoms can, right? So we do advise persons they could access their closest healthcare facility, their health centers, or right here in Georgetown, we do have the Palms, and they have an open clinic to the public, those that are elderly, of course. They presently work on Tuesdays and Thursdays from 8 to 4. And we have specialists there as well, not just at the Palms, but at Georgetown Hospital, which will be able to screen your loved one to know if they're suffering from dementia or Alzheimer's or any other affectation. And in Guyana, we do have medications available to help all symptoms that may result from Alzheimer's or dementia.
Wonderful. How can caregivers support family members who may experience these conditions?
The first thing we really have to do is recognize that some of the things we say, oh, the person is doing it deliberately, or they're being malicious, they're just trying to be difficult. Once you have a loved one that you realize they're acting out of character, because obviously these things would have had to be that the person wasn't acting like that before.
Yes.
We need to realize that something is wrong and seek help for them. And like I said, doing our own little research, but reaching out to your closest healthcare provider, you will get more advice, you will get support, because of course no family member was ever taught how to take care of an older person. So that's why we're here at the Ministry of Health and all your healthcare facilities to give you that advice. It may be difficult with these persons to deal with their change in mood and emotions. So definitely you need to seek help and not just, be by yourself and be frustrated. I don't want persons to get the idea that when you get old, you get miserable. So that's not the hard and fast rule, right? So once we realize mom or dad, grandma or grandpa, they're having a difficult time, they're acting out of character, we can seek help for them and get that advice from our healthcare provider. So us as the caregivers will know what to do and how to do it.
Wonderful. Thank you, Dr. Dehart. One of the things that we see so often in elderly persons are falls. How can we prevent falls? And what can persons who are at home, like family members, what can they do to help senior persons prevent those?
Right. So falls in of itself is one of many things that affect our elderly. And many older persons at home right now, they fall and they keep it a secret, because one thing we have to understand, persons are afraid of losing their independence.
Yes.
Right? Because a lot of older persons, they may live by themselves, and the first thing they think, oh, if they know I fell down, they will take me out of my home and take me to live with them.
And one of the things that I realized too is a lot of older persons, they like to do things on their own.
Yes, independence. I would like us to put ourselves in their shoes, because we will get old one day. Think of yourself now. You don't want anybody to take over your life, right, and do everything for you. So independence is very important. So some of the things that we have to look out for that could make an older person more prone to falls or make falls possible. Number one, we need to make sure that persons are diagnosed and treated for any illness, such as high blood pressure, high blood sugar, not being able to see properly or hear properly, because obviously all these things could contribute to them falling down. If they can't see or hear their surroundings, they can fall. Or if they have high blood pressure, high blood sugar, they could subsequently become dizzy or get bad feelings, like we say, they could fall. We need to also look at the home, the surroundings. Are we wearing the proper footwear? We need to make sure our elderly have the proper footwear for in and outside of the home. Make sure our furnishings, wiring, all these things are organized and set aside to prevent tripping. Proper carpeting, handrails are also recommended for older persons that may have joint problems or they're fragile. And it's very easy, nothing fancy. You could get a piece of PVC pipe with the couplings at the end, and you put a handrail by the toilet so they could pull themselves up. You put a handrail in the bathroom so they could hold on while they shower, or even a little plastic bench so you could sit and be comfortable, because we do know, especially when you're dealing with a wet surface, falls can be dangerous. Lighting is important as well. We need proper lighting so the elderly could see where they're going, etc. So those are just a few things we could ensure that the person of themselves, they're well diagnosed, taking their medications on time to avoid dizziness, bad feelings, have our eyes and ears checked so we could see where we're going and we could hear danger. And make sure our home is well situated and danger free. And I like to compare it to the same precautions we will take for our younger family members, our children, the same precautions we need to take for our older family members, especially those that may be fragile or need a little more help. Additionally, our walking aids. So persons that may be in need of a walking stick, wheelchair, etc., we need to ensure or try our best that they get those to prevent them from falling. Additionally, it is not known that these things need to be maintained. So if somebody is using a wheelchair, they need to make sure the wheels are checked, make sure the brake is checked. And the walking aids, like the walking sticks, etc., you have the ones with the four corners and the single ones. They have a little rubber piece at the bottom that keeps them from sliding. Those wear off. Presently, to my knowledge, at the Ptolemy Center, they repair and fix those rubbers on the walking aids for free. So you can take any walking aid you may have, their wheelchair, etc., and they could help to maintain and fix, just to avoid the danger of falling. So those are just a few tips.
The health fair was indeed effective. I got a chance to learn a lot of different stuff from the different departments. These are services that we don't usually get to, in a sense, know that we can access on a daily basis. And to be here today to see that the government of Guyana, or the health sector in the whole, has so a wide variety of services that we as people in the public can access and have access to and learn about. It was really quite interesting. It actually blew my mind. Better practices, especially with mental health. I really loved that booth. It was quite interesting to know that there's such healthy coping mechanisms that you can use. I will definitely schedule visits to my doctor. Being a man, seeing the men's health unit here today was really, really interesting, and you got to learn a lot about your prostate health and your overall men's health in a sense. And so I will be making those adjustments to be a healthier Guyanese and a healthier man.
Quite a few services that I was not aware of, I have been able to be knowledgeable of. I visited quite a few booths and I was very impressed with what they have to offer. So I'm now better aware of institutions, organizations that you can seek help from, in terms of knowing and being aware that if something is wrong with you, you can approach some of these organizations that is here to improve on your health condition.
Welcome back. For those persons who've just tuned in to our live, I'm Alicia Martin, and I'm here with Dr. Martin Campbell, the Technical Officer for Cancer and Chronic Disease attached to the Ministry of Health Chronic Disease Unit. We're here at the Artachon Convention Center, where the Ministry of Health is hosting the Caribbean Wellness Week Health Fair. Thank you for joining me, Dr. Campbell.
Thank you for having me.
Could you tell us, the viewers, a little bit about what is happening today, especially at your booth?
Okay, so we have two booths, if you could say. We're actually having a booth for chronic diseases. So that booth, we have our technical officers and other staff there. That's giving a lot of information on chronic diseases. So we're talking about diabetes, hypertension, cancers, and a few others. Also, we have a few NGOs who are working with us here. So we have the Periwinkle Club, which is a cancer-related club. We have the Guyana Cancer Foundation. We also have some other groups, the Kidney Foundation and so forth, that are here to give information, to lend assistance in any way.
So, Dr. Campbell, we want to talk a little bit about cervical cancer. For those persons who are viewing us, and even those who are listening to us, could you tell us what cervical cancer is and some of the risk factors that contribute to that type of cancer?
Okay, so cervical cancer, as the name indicates, it's cancer that starts in the cervix. So the cervix is a part of the female reproductive system. It's part of the womb, the mouth of the womb as we call it, where the baby or so would normally pass through. So it's basically cancer that forms there and can spread to other locations if it's left untreated. So that type of cancer specifically is caused by a virus called the HPV, human papillomavirus. And that virus usually is very easily transmitted, and the signs and symptoms aren't usually present. It doesn't give you a lot of signs and symptoms. So a lot of persons don't know that they have HPV, and depending on other factors that they may have, they can develop cervical cancer.
Okay, and I know with regards to HPV, there's vaccines available for that.
Yes, so they have vaccines available for a while now in the country and even around the world for quite a few years. Very effective, almost 100% effective against the formation of cancer of the cervix. And it's free in Guyana, it's readily available. You just need to access it at your health center, nearest healthcare facility. It's usually predominantly we target girls 9 to 16, but boys are also able to access it as well, because if we want to create herd immunity,
Yeah.
we need to be able to target both of them at the same time.
Definitely. What are some of the symptoms or early signs and symptoms that persons should look for with regards to cervical cancer?
So cervical cancer doesn't usually give a lot of early signs and symptoms. So the warning signs usually come at the later stages
When it's more
cancer is
developed.
already developed. So you usually find those in stage 2, stage 3,
Yeah.
and so forth. And it's usually symptoms that are very common when we look at the patients you might see. So we're talking about abnormal bleeding from the vagina, and that's not a symptom that's specific for cancer. Right? There are many other ailments that can cause that. So a lot of times we find women not taking a lot of heed when they see a sign or symptom, because they think it's something else. It's related to something else.
I know over the years the ministry has been focusing a lot on prevention.
Right.
So what can persons or women do to prevent such development of this cancer?
Right. So first thing, in terms of prevention is vaccination for cervical cancer. So the HPV vaccine.
Yeah.
To follow that up for women who aren't eligible for the vaccine, we have screening. So the policy at the Ministry of Health is the VIA screening, which is visual inspection with acetic acid or vinegar, household vinegar. So it's a simple test. We use a little bit of vinegar to swab the cervix, and that usually, if there's any abnormal cells there, the vinegar gives us a reaction that we can visualize with our naked eyes. So once we're able to do that, we can offer that woman treatment right there and then to get rid of those cells.
Okay, do you need to be a specific age to access the service with regards to VIA and the pap smear?
Right. So for VIA, we target women who are 25 to 49 years, because at the age of 49 or older, when certain physiological changes occur, even at the level of the cervix, the area that we look for isn't visible with the naked eye. It's called the SCJ for short. So it's not visible with the naked eye, and so in those women, we'd recommend a pap smear. So for women who are younger than 49, from 25 to 49, those are the target age for VIA. If you're younger than 25, you're sexually active at least 3 years, you can still get a VIA. You should still start screening, because we do know in our society today, a lot of young girls, teenagers start having intercourse and sexual activity at early ages, and that's a risk factor for acquiring HPV and developing cervical cancer.
I feel as though this event is very effective because we all find it hard to practice positive activities that would contribute to our wellness overall. So having an event like this gives persons, especially professionals like myself and members of the community, an opportunity to come out and actually have services at your doorstep that would teach you how to properly cope, how to live healthier lifestyles, and be healthy overall. You know, the minister would have spoken a bit ago about how we could just implement some positive activities into our lives to increase the duration of time that we live. And oftentimes it starts with the little things. So an event like this, being a young professional, is very much effective for me, and I feel that we should do more of these because we all need it. And I think we should publicize it more so that persons know where to come, when to come, and what services are available. Okay, so I did a blood pressure test and I was a bit surprised by that. And I saw that it was a tad high, so I too need to take it easy and realize that health in general is very much a thing I need to prioritize and focus on. And being a healthcare professional myself, oftentimes you feel it's like, oh, you know what, you are excluded, for want of a better word, from certain illnesses and so on. And you know, it's a lesson to learn from, and I would definitely be taking the tips I learned today.
All the booths that I visited thus far has provided vital information, even information that you hadn't taught, but you just need some clarity. The booths were able to provide that. For example, I can say what stood out for me was the environmental health department. with, we have a lot of mosquitoes going around right now because of the interchanging of the weather, and the information that we needed, how we can prevent mosquito bites in our home, what we can do. I was even impressed that they have a mosquito catcher. Yes, I was very impressed with that, and I've never seen it before, but I saw it this time here. One of the booths that I visited that was very informative was the United Nations also. They had very vital information for you and how you can get help. Because I was even inquiring about those visitors that are in our country, for instance, the Venezuelans, and I was very much impressed to know that they have handouts in the Spanish language available for them. So that was very impressive also.
Well, we've got Dr. Dennis Bassier, coordinator of the Men's Health Unit of the Ministry of Health, and we'll be talking about men's health. Dr. Bassier, welcome.
Thank you.
Talking about men's health, that can be something hard to do. Why are we targeting men?
No, why aren't we targeting men?
Yeah.
Right, the men are as much a part of the population as the women, and well, as you know, men have far less health-seeking behavior than women.
Mm-hmm.
So we need to actually get them into our healthcare centers, into the habit of seeking healthcare more often.
What do you think is the number one issue when it comes to men's health?
Oh my. Well, I would say their attitude towards health.
Mm-hmm.
That is their biggest hindrance. Because once we get over that hurdle of them not wanting to seek healthcare or not seeking it freely, everything else would fall into place. Right? So all the specific issues that face them, all that could be, avoided.
What do you think, if you've done your research, why men don't want to go to, and even, sometimes I know the maternal child health unit would encourage men to even go to the antenatal clinic,
Yes.
even with their wives or on their own to take a child.
Even take the children to get vaccinated.
But sometimes, men don't want to go. Well, what could be some of the reason?
Well, there's always machismo, right? Health is never something
Men is not supposed to be sick, right?
Yeah, we're not supposed to be sick.
Yeah.
Right? That's traditional. That's passed down from generation to generation. But even so, the local idea is that the health facilities do not have anything that, makes it welcoming for men. So even down to something as simple as a poster on the wall, you see them reflecting more the women and girls or the pregnant women, the children. So something as simple as that we're looking to change. Matter of fact, we have started that. So you're seeing more men involved in posters and brochures, right? Even murals, and so you're seeing men more prominently displayed in these things when it comes to their health aspect.
Do you think other people should, people in the home, in the workplace, do you think you target those people in the workplace at least to sensitize men to, the importance of seeking help?
Definitely. And just in June, when we observed International Men's Health Week, we launched an initiative. It's called the Well Man at Work. And that simply is actually taking the health center and the services to the men where they are in their workplaces. So if it is that you have a business near to a health facility and you can't find the time to actually come out to the health facility to get checks, the workers in that center would select a day, whether it's once or twice a month, and just visit your business to just actually carry the services to you. So if it is that you discover that anything is wrong with you or, just irregular, at that point in time, you can make an appointment right there and then to actually go to the health facility.
Do you think sometimes men have an issue with, or the notion that there might not be confidentiality at some of our health facilities?
That's all over. Right. Sadly, that is all over. But of course, we can always plead to the healthcare workers to just try to maintain that level of professionalism and understand whether it's doctor-patient confidentiality, or even with the nurses. So we just have to keep trying. That's an uphill battle.
What's some of the other areas you guys work on and to push men into health-seeking behaviors?
No, we just try to get them to understand why it is that they need to be healthy. If it is just for themselves to continue working to make more money, or for their wives, for their children, just to get out there and live a healthy, happy life.
But do you think that's an easy excuse, that they have to work almost 24 hours and to be the breadwinner? That's a good excuse.
Yeah, it is a good excuse.
But they have time for the nearby bar, right? And they exercise here.
Yeah.
That's it, with exercise your elbows.
Well, as they say, if it is that you want to continue that, you still have to get healthy. Even if it is to continue drinking, you still need to be healthy so you can continue drinking, right? If it is that you live a healthy lifestyle, just continue what you're doing. But we need them to understand that this is actually about quality of life, not necessarily the quantity of it.
And we talk about that when those things are readily available. Bad drinks, bad food, and sometimes men and of course women may not necessarily look at it because sometimes people build barriers to education. You think education also plays a vital role for
Definitely.
men and generally the general public on the whole?
Yeah, we try to increase health literacy as much as possible. At every possible avenue we can get to increase health literacy, we try to get it out there. Even in the schools, there are school health clubs through the adolescent health department, and of course, adolescent health. There are adolescent boys and girls also. So, even though it says men's health is intricately woven into every aspect of healthcare. Even for maternal and child health, you can't have a mother without there being a father in there, right? Women's health, elderly health, there are elderly men also. So adolescent health is no different. So the school health clubs actually plays a big part in reaching them before they get into that adulthood. So health literacy is one of the main things that we see to actually reach our goals as it pertains to having healthier men in our country.
And to our last point, of course, all of these linked to something which has become a sort of, a major factor in our community, and that's domestic violence.
Yes.
Where apparently the men always seems to be the bad guy.
Yeah.
And so, all of that is taken into consideration with your department?
Of course. But more so, we have to look at the paradigm shift that's happening in our society, in which men are also becoming the victims, more and more the victims of domestic violence, right? So let's just say we have a little guy, for instance, me, I weigh just about 150 pounds, 150, 160 thereabout. But let's say I prefer the big girls, right? And then if it is that we were to have a disagreement for some reason, I'm easy prey for her. That's not to say that the police would not believe me if I say, well, she hit me first and then I hit her back as a consequence of that. So even though our men have traditionally been the perpetrators of the majority of domestic violence cases, we are also the victims in this day and age too. And we're looking to have that mindset changed so that we have healthier relationships. So there's not this, okay, well, it has to be the man perpetrating this act. So domestic violence, whether it be the male or the female, we're just looking to have that eradicated.
Thank you, Dr. Bassier. In the event you need more information on the men's health unit of the Ministry of Health, please visit the Ministry's Facebook page, and not only for that unit, but for all the units of the Ministry of Health. Please send an inbox, and of course, it will be directed to the relevant unit. Thanks for watching. Well, that's all the time we've got on our program, Alicia. It's been very informative speaking to a number of doctors and getting, an idea, and our viewers that have an idea of what we do at the Ministry of Health.
Definitely. I trust that from this activity and from this week's observation, each person in Guyana will think about living a healthy life and really taking the necessary practices to get that done.
So do join us again next time. And until that time, be safe.